Hi, I'm Amber Carson, and I'm an employee at Thermo Fisher Scientific. I work on the corporate accounts team, and I'm located in Michigan within the United States. My husband and I have two beautiful children. However, we have had two very different pregnancies and experiences from the two of them. Our oldest is a daughter who we were able to conceive very quickly and had a near perfect pregnancy with, and as well as delivery. Our second was a little bit more complex in the sense where we ended up using in vitro fertilization to get pregnant with him just due to secondary infertility. Being pregnant with our son was, of course, incredibly special to me. We had worked very hard and gone through an awful lot to conceive him. And the pregnancy overall was much more challenging than it had been with our daughter. I would say one of the most challenging parts was when I ended up having signs of labor early on in pregnancy. It was around 30 weeks. I would say about midway through the pregnancy with our son, I was diagnosed with placenta previa, and that is where the placenta makes it, in most cases, very difficult to have a vaginal birth. I was okay with that, and I knew that having a C-section was our best bet. But they did warn me that with placenta previa, there could be complications and things to look out for, such as bleeding. 30 weeks was the time when I first experienced some bleeding, and it was quite heavy. Of course, it was very frightening. I did not know what was happening. I called my doctor's office straight away, and they encouraged me to get into the emergency room so that way I could be examined and to make sure that our son was doing okay and that there weren't any complications with the birth. I was very surprised when they decided to keep me overnight, and they wanted to run several tests because they couldn't figure out what was going on with me. Of course, no parent wants to hear that you're in distress and that they don't know what is wrong. The doctors ran several metabolic panels on me, and there were some very abnormal labs from my kidney levels, my blood sugars, my blood pressure. However, all the pieces of the puzzle were not coming together, and they couldn't quite figure out what it was. The term preeclampsia was thrown out there as a possibility. I had heard that term preeclampsia before. I had mainly heard it just occasionally in the media. I may have had some girlfriends who experienced it, but it was never anything that I had researched on my own in depth, and I certainly didn't know any of the risks or the warning signs or symptoms that were affiliated with it. It was very nebulous to me and just sounded scary, but not anything that I had really thought would be part of our pregnancy story. So while preeclampsia was definitely part of the equation because of my increased blood pressure, there were other things at play that were difficult to figure out. And so some specialists from maternal fetal medicine did some additional panels and some observations on me. And what had started off as preeclampsia had very quickly gone to severe preeclampsia and had escalated to HELLP syndrome. Certainly, I had never heard of HELLP syndrome before, and many people hadn't. And HELLP syndrome stands for hemolysis, which is where your red blood cells start to break down, elevated liver enzymes, which was showing up in my panels, and then low platelet counts. And so all of these were basically this perfect storm and like a ticking time bomb in my body. So at that point, it was becoming very clear that what I thought was going to end up being a full-term, quote-unquote, normal pregnancy had really just been taken away from me in that 24-hour period. and that we were going to be delivering our son much sooner than we anticipated. "30 weeks delivery is considered extremely preterm when it comes to infants. Certainly a NICU stay was going to be in the mix. Luckily, our hospital has an incredible neonatal intensive care unit with some just phenomenal doctors and support staff there to take care of our son. However, it didn't change the fact that I really was scared. I didn't know what to expect. I didn't know what it meant. Not to mention that with the HELLP syndrome, it's very rare and can oftentimes be fatal for mother, baby, or both. So of course that was looming in the back of my mind of what was going to happen, and almost just this sense of like waiting for the other shoe to drop at all times. So our son ended up spending 61 days in the NICU. And I'm very, very happy and blessed to say that he is a strong, vibrant boy today. He just turned 1 in January, so his birthday is January 29th. He was meant to be born in April, so again, 10 weeks early, and he spent a little over 2 months in the NICU, which became our home away from home. I wish I knew more about preeclampsia symptoms, the warning signs, what to expect, what could happen before it took place. I don't know if I could have done anything to prevent it at the time. However, if I had known more, if there had been more awareness, if there had been more people talking about the fact that in vitro fertilization can lead to an increased chance in preeclampsia, I certainly think that I would have been a little bit more tuned in and aware of that possibility. I would encourage all women to really look into preeclampsia. The best thing you could do is be an advocate for your own health and safety. So knowing the warning signs, understanding what those look like, I would just say speak up. You know, the more we share stories like this, the more we can add some understanding, some advocacy around it, and also not to feel like you did anything wrong. A lot of times things like this can not be avoided. And I think the biggest takeaway I had is just making sure that I share my story with others, let them know that they're not alone, and not everyone has as wonderful as an outcome as we've been fortunate enough to have, and just to let people know that it's powerful to use your voice and to make sure that you continue to do that. So let's celebrate preeclampsia awareness in May, and let's use our voice and speak up so that way others can be strong and speak up as well. Thanks.